Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right and the lower right wisdom teeth, and the upper left and the lower left wisdom teeth. Starting with the upper left wisdom tooth, as you can very clearly see here, that it is distoangular impacted, especially in the upper segment. This is where the tooth is, as you can see, embedded very heavily into the distal aspect of the seven, and then we've got the roots embedded into the sinus as well. This is a severe distoangular impaction with the crown facing towards the bucco distobuccal aspect, and the roots are embedded into the sinus as well as the distal aspect of the seven. The lower right side, as you can see, horizontal impaction. The inferior alveolar nerve is in a very intimate contact with the apical one third of the inferior alveolar of the lower right wisdom tooth. It has two roots, none of them are fused, and the mesial root is in very close contact with the inferior alveolar nerve. Moving to the lower left, we've got a vertical impaction on the lower left 8. The distal root is again, the apex is in a very intimate contact with the inferior nerve. It is just at the apex of the tooth, not medial, not distal, just at the apex. As you can see right here, very closely associated. Not the medial root, but the distal root is definitely very closely associated. We've got slight bit of a cystic lesion developing on the crown as well. And the upper left 8 is also distoangular impaction, but not as severe as the right side. The roots are embedded into the sinus just below the lining, not as closely associated with the roots of the seven. This is the axial view or the top to bottom view. Here you will be able to appreciate the seven, the eight on the left hand side, which is right here, and then the eight on the right hand side, which is right here, and then you've got the two upper eights, which you can see right here as well.